Good afternoon, this is Dr. Do again. This video is alphabetic list the problem of D, diabetes. And we talked before, I think I have mentioned the diabetes in a couple of videos. One is complications and the other one is about lifestyle modification and comply with your physician and monitor your blood glucose at a regular basis. And today I'm going to systemically talk about diabetes from the mechanism, the insulin secretion, the insulin structure, and the response from the peripheral tissue, the receptors, and what is the consequence and different type of diabetes, type 1, type 2, for example, and gestational diabetes. What are the significance or difference between each kind? So basically, in order to understand that, let's talk about start from three major organic compounds. Carbohydrates, protein, and lipids provide structure and also the energy for the body. The other type of organic compound, nucleic acid, break it down into elements and contribute to the amino acid synthesis or contribute to the genetic material such as DNA synthesis. So these are the four major organic compounds. Diabetes is the carbohydrates metabolism impaired, which means the glucose cannot be metabolized, cannot be taken by the body, so circulating the blood and binding to the protein and increase the viscosity of the blood, cause micro vessels, either through microthrombosis or the new blood vessel generation, cause the bleeding, loss of function to the end of organs like the kidney, the retina, and also the nervous system. So this is the general picture of diabetes. What is about? Let's talk about first of all, let's talk about the pancreas. Pancreas is the organ, one of the major endocrine organ secrete insulin. Okay, so pancreas is lying straight. Lying on the upper abdomen across the duodenum and the spleen. So that's the pancreas structure. And the pancreas, there's some small structure of islets. Islets has alpha beta cells secreting the insulin from beta cells. Alpha cells secreting the other hormone, which is antagonist of insulin. I'm not going to talk about that, which is glucagon. So the insulin is secreted by the beta cell of pancreatic islets. So what does insulin do? Insulin is binding to the receptor. Where are the insulin receptor located? Located in the adipose tissue, which is the fat tissue, and muscular tissue, which is the two of the major organs to take glucose for the storage, make glycogen to store in the body, and also some of them in the liver. So basically the glucose, we take the carbohydrates, for example, you took a candy. The candy digested through the body, absorbed, circulating the blood as glucose. And those glucose provide energy for the brain, for the body, and the extra of those glucose will taken by the muscle or adipose tissue to become the fat or become the glycogen in the muscle to storage for the energy for the muscle contraction used. So this is the mechanism. So there are two types of diabetes, type 1, type 2. Type 1 is it's very well known, it's very well studied, and the mechanism is pretty much clear. It's because the insulin beta cells was destructed. So the beta cell cannot secrete insulin. So those kind of patients start from young, either autoimmune or genetic cause, the beta cell cannot synthesize insulin. So those patients has to depend on insulin lifelong. So that's the type 1. It's usually called the juvenile type. Type 2, however, it's related to to overweight, obesity. Why? Because the overweight, obesity people, their beta cell receptor, the insulin receptors located in the adipose tissue cannot take insulin, cannot respond to insulin, cannot respond to the insulin, then couldn't get the signal that blood sugar is high in the body, so cannot take those glucose to synthesize adipose or synthesize as the glycogen. So that's why the glucose circulates in the body. And those elevated glucose beyond the kidney absorption capacity, so that's why the glucose back to the excreted through the urine. So that's why diabetes checked urine also has the glucose in the urine. So this is the basically the physiological fundamental medical mechanism for the diabetes. Type 1, type 2, because of this insulin either not produced enough, or the peripheral tissue will not respond to insulin, so cannot take glucose. So then this is the mechanism. Then what happened in the glucose in the blood, I have mentioned before, because it conjugated with albumin, so precipitate in the small blood vessel, cause the inflammation, local reaction, inflammation, new blood vessel, or microthrombi, or blood vessel damage, or new blood vessel generation, which do not have the regular blood vessel function, so undergoing ischemic hemorrhagic change to damage the organ toward the end stage. So this is the mechanism for insulin, and how the diabetes occurred, and why it's so bad if you have glucose in the body. So that's majorly because make the blood sticky, form the microthrombi, or damage the blood vessel wall, and stuck in the end of blood vessel and damage the organ such as kidney, nervous system, and also even the retina. So these are those end organs where you have those microvascular structure damaged and change, will have ischemic and hemorrhage, so impaired function. That's the ultimate end of the diabetes. Why it is so bad. So why is why it's so important to control the blood sugar? The mechanism is like this, to prevent end organ damage. Those end organ, of course, heart is the one, very important one. So diabetes is already very well known. Diabetes causes high risk of cardiac problem, and also the liver, the kidney, and the nerve system, stroke, and also the retina. So these are the complications and the stage. So that's basically from the fundamental mechanism to explain diabetes, why it is so important, why your physician pushing you to control your sugar in the normal range. Because if it's not, then if your blood sugar is not in the control, eventually with time those complications will happen. In the retina, we have the diabetic retinopathy. It could be very severe intravitreous hemorrhage, or retina under the retina has hemorrhage, and also eventually lose impaired vision. And the kidney cause chronic kidney disease. Microalbumin cause the blockage of the blood flow, so the kidney will damage. So these are, and also in the liver and nervous system, increase the risk of stroke. So this is the very deeply on the basic medical knowledge to explain for you about diabetes. I hope it helps you. You probably just know your physician push you control your sugar. You know it. You know. You probably in your mind, oh, I have to control the sugar. This is give you explanation why you have to control your sugar if you have it. For those still healthy without diabetic, now you know the significance to maintain a normal body weight, maintain a normal glucose level, so then maintain in general well-being in the healthy status. So this is another video talking about diabetes, because it is so common. It's just accident. A lot of people think I had a very good body weight. Suddenly, like accidentally, I gained 5 pounds. And then accidentally I gain another 10 pounds. So that's so do not make those accidentally gaining weight. Keep mind straight body weight maintaining, and also exercise, healthy diet, maintain a healthy lifestyle to prevent diabetes or to delay the progression of diabetes to the end stage. So this is about for this video, and thank you for watching. I will see you next time.